Hey everyone, this is Abby with nursing.com. In this video, I'm going to show you how to apply your nursing knowledge to answering a Next Generation NCLEX item type matrix multiple response. This might be new or unfamiliar to you, and you might have some nursing knowledge to gain in order to answer this particular question, but this video will serve to give you some strategies for making the new and unfamiliar a lot less scary. Let's get started. You'll know that it's a matrix multiple response question because of the matrix setup. And there are boxes or squares that allow you to make multiple responses. It's organized into a matrix with columns and rows, and then as mentioned, you'll have the little boxes that tell you how many responses you can make. Now, you'll also know that it's a multiple response question because it kind of looks like a regular SATA question or select all that apply. To succeed with a SATA question, use this success pyramid. First, you can cover all of the other options and read them one at a time. Evaluate them individually. And you can do that by turning it into a true or false statement. We'll talk about that. In fact, let's look at a real question. And here we are. Now you can see the matrix. A matrix is built with horizontal rows and vertical columns. Before we go into being able to select multiple responses for this question, we need to know what the question is asking us. Let's read it together. Click to indicate which interventions the nurse would anticipate for initial management of a stage 1 postpartum hemorrhage caused by uterine atony, thrombin disorders, trauma, or retained tissue. Each intervention has at least one, but may have more than one response item selected, hence multiple response. And it's in a matrix multiple response. So we're going to treat each of these columns for the condition like its own select all that apply question. And we'll pick from the interventions that go along the row. So let's start with uterine atony. Uterine atony is when the uterus itself after delivery can be large and boggy, meaning it's soft and lacks tone. That's what atony means. Now, right off, I know that fundal massage gives tone back to the uterus. It causes it to contract and tone up or firm up. And that is a classic hallmark treatment for uterine atony. Oxytocin is a medication that's going to help create contractions in the uterus and also help to give it tone. And we know that this patient has a stage 1 postpartum hemorrhage, which means she's been bleeding. Stage 1 postpartum hemorrhage specifically is when a vaginal birth has resulted in a blood loss of 500 cc's or more. So with this patient, you're going to go through the EHR to find out just how much this patient has lost if that's in here. And or we can find out if IV fluid is appropriate for treating this uterine atony based on the lab notes or the lab values. This patient has definitely lost some blood. The hemoglobin and hematocrit are just out of range. And so we know that this patient is fluid down. So she really does need some fluid. And this is a great treatment because she's had a uterine atony that has caused the postpartum hemorrhage, okay, or part of what's caused it. When we look at thrombin disorders, this column, do we know, would administering IV fluid help with that? I would think that this is a great treatment because if this patient had a thrombin disorder, they're going to bleed faster and not clot. And so they're also going to be fluid deficit and need some extra fluid on board. Now, fundal massage doesn't treat thrombin disorders and nor does oxytocin, and preparing them for a procedure is also not appropriate for this column. But if they have thrombin disorders, they've got tough time clotting, they're going to need some platelets. So this is a great choice for this one. When we look at trauma, I always think of fluid resuscitation in cases of trauma. So definitely some administration of IV fluid is going to be helpful. However, fundal massage and oxytocin, if this is a trauma, this is a more emergent situation, this is probably going to come in later or maybe not at all, but definitely this patient is going to be prepared for a procedure. If their platelets are low enough and we just don't have that information yet about this patient, they might need fluids, but it's specifically not going to treat the trauma like it does a thrombin disorder, right? And this patient, by the way, when we look at the platelets, they're just out of range. She's on the low side, but that's not going to help in the case of a trauma. Our last column is retained tissue. Let's take a look at this one. Now, retained tissue is a risk factor for developing postpartum hemorrhage. And again, we know that this patient has had that, and we need to get her fluid regulated, euvolemic, right? So that she's nice and even. Fundal massage and oxytocin, however, they're not necessarily going to help to treat retained tissue like they do fundal massage and oxytocin for uterine atony. However, if there is retained tissue, there needs to be a procedure. This is a surgical intervention needed, just like trauma. And so we need to prepare this patient for a procedure. Also, infusion of platelets doesn't directly treat retained tissue. Let's go ahead and submit this quiz and take a look at the rationale briefly together. Great job. If you didn't pick all of them correctly, this is just an opportunity for some more learning. It may be that we need to get some more indications from the EHR or brush up our knowledge on postpartum hemorrhage specifically. So it's great. We were right. We picked all of the right interventions for each column and treated it as its own select all that apply question. And just like the question said, each intervention had at least one and had more than one, because the question told us we may have more than one item selected. Great job. So as I said, make sure to pour through the rationale on each question so that you know what you missed and use it as a learning opportunity to either reinforce your learning or remediate and go back. Great job. To wrap up, the linchpins for this lesson are that this is a matrix multiple response question. To answer it, pick the appropriate interventions for each cause of postpartum hemorrhage. It helps to treat each column as a separate select all that apply question. And the question told us it might be one or it could be many responses. We showed clinical judgment by picking out the appropriate interventions for management of stage 1 postpartum hemorrhage. You did great. If there's some more learning opportunities, definitely check out the postpartum hemorrhage lesson so that you can learn all that you need to know about that condition and what causes it. Otherwise, I want you to remember, we know you can do this and we love you guys. Now go out, be your best self today, and as always, happy nursing.